Welcome to Healthcare Musings, a podcast dedicated to the discussion of critical care and healthcare in general. Here's your host, Dr. Hesham Hasabala.
Hey everybody, Hesham Hasabala here. Happy to have you with me. I'm going to get this editorial comment out of the way. I knew that as more and more states, including my own in Illinois, legalized cannabis, that problems would start emerging. I knew it. I never believed that cannabis was as benign as everyone makes it out to be. Let me get that editorial out of the way so you understand where I'm coming from. And at the same time, the purpose of this episode is to highlight awareness on the part of clinicians, hospital medicine clinicians, and especially critical care clinicians about this issue with respect and associated with cannabis use. And I saw this article in the New York Times. It was published October 4th, and it is entitled, "As America's Marijuana Use Grows, So Do the Harms." Again, cannabis is becoming legal in more and more of the country, and the article highlighted that clinicians all over the country have been finding and taking care of patients who have had delusion, psychosis, paranoia, and another condition that I really wasn't very aware of and I hadn't really seen, called cannabinoid, I think it says, hyperemesis syndrome. Let me make sure. Cannabinoid hyperemesis syndrome, where it is a condition that is marked by nausea, vomiting, and pain, and it can lead to extreme dehydration, seizures, kidney failure, and even cardiac arrest. And according to the article, it has caused 8 deaths in the United States, according to this article. The syndrome was first documented in 2004, and there has been a sharp rise in the number of cases. And so I think it's important for us to be aware that if somebody comes in with hyperemesis syndrome, and they highlight actually the case of a patient named Jennifer Macaluso, who is in Elgin, Illinois, who was taking cannabis to help her severe migraines, and then she had this cannabinoid hyperemesis syndrome, and it made her extremely sick. And so if we have a patient that comes in with severe nausea and vomiting, dehydration, organ failure, because I can see if it leads to hyponatremia, that leads to seizures, or perhaps hypokalemia, that leads to cardiac arrest, I think we should be aware and start asking our patients about cannabis use. A lot of times we do, urine drug screens, and sometimes it comes up and sometimes it doesn't. And I think we should always be on the lookout for cannabis use and ask about cannabis use, especially if someone comes in with severe nausea and vomiting and dehydration. We should ask if they've been using cannabis. And what's interesting is that heat often temporarily relieves the nausea and vomiting. And they were saying these are reporters for the New York Times did hundreds of interviews and survey responses, and they said that there were people that spent hour after hour in hot baths and showers, and some were even burned by scalding water. One teenager pressed his body against a hot car. So that's something important for us to ask. Does heat relieve the symptoms? And then that further will lend itself to the diagnosis of CHS, cannabinoid hyperemesis syndrome. I had never seen a case, and when I saw this article, I think it's really important for us to be aware of this possible condition. And then the article, it's a pretty long article, but it goes into also people that have had psychosis, people that have had hallucinations, paranoia, and so again, a lot of people take cannabis for medical reasons or recreational reasons and are fine. And I think as more people use cannabis, as more potent forms of cannabis are available in dispensaries all across the country, we as clinicians in the critical care space, in the hospital medicine space, in the emergency medicine space, should be aware of these conditions, especially CHS, so that we can properly treat these patients and know what is the cause. Anyway, thanks so much for your time and attention. And until next time, this is Dr. Hashem Hasabala signing off on Healthcare Musings. Thank you for listening. Please follow and subscribe to the podcast at healthcaremusings.com. And don't forget to give us a 5-star review. Thank you so much.